The midnight deadline has come and gone for hundreds of union workers at Catholic Health, and a strike is now underway for healthcare workers here in the city of Buffalo. This is a live look outside South Buffalo Mercy Hospital right now, where workers remain on the picket line. Good evening, everybody. I'm Mary Alice Demler. Scott Levin is off tonight. Well, we heard from Catholic Health today, as well as union workers, on where negotiations stand tonight. Let's start with the healthcare system's perspective, and two on your side, Steve Brown. He's live for us as well. Hello, Steve.
Good evening, Mary Alice. Yes, there was a news conference by Catholic Health CEO Mark Sullivan this afternoon. He was throughout it very complimentary of his striking workers, calling them the soul of Mercy Hospital. He added that he thought the two sides were close to a deal when the union announced it was headed to the picket line. Now, Sullivan insists what the CWA was looking for in a deal he put into the last contract proposal. He says it provided higher wages for staff at Mercy, as well as Sisters, Kenmore Mercy, and St. Joseph's hospitals. And Sullivan says Catholic Health is prepared to add up to 230 more workers, addressing the union's staffing issues. Difficult to do when the hospital staffing is short all around the country, but Sullivan says he was ready to work with the union on that, recognizing that they'd been through a lot in the last 2 years.
They've been through a pandemic. They're still dealing with a pandemic. I respect their energy. They're our associates too. I respect their energy, their desire to have a fair contract, their desire to be able to take a breath. This is a national crisis, and I'm standing here today as a CEO of Catholic Health to tell you I am 100% committed to addressing the crisis. It's a journey. It can't be a one-day event that's fixed.
Meanwhile, Catholic Health's Mercy Hospital still has patients to care for. About 200, Sullivan says. To address that issue, with its staff on strike, they brought in replacement workers. A company by the name of Huffmaster, which is out of suburban Detroit, has supplied them with a number of different staffers. It ranges from healthcare professionals like nurses and others to support staff to security around the building. Now, Sullivan says, now this is costing Catholic Health millions. He wouldn't say how much. When asked why it is or how long it is that he could sustain this, he said he simply did not have a choice. With his staff out on the picket line, he needed to spend that money to bring people in to do the job of caring for those patients. That's the perspective from management side. Of course, there is a union perspective, and Ron Plants on the picket line has that story tonight. Ron?